The riot of colourful chunaris immediately tell us we are in Rajasthan. A land once vied for by competing rulers. The glory of the past, however, is now confined to its forts and palaces. Inside most rural homes in the state today, the arrival of a newborn baby brings as much apprehension as celebration. While a timely emergency visit to the hospital can be a lifesaver for a mother or a newborn, such visits are an anomaly here. Not surprisingly then, the chances of survival for both the mother and infant can be quite low, at par with the most remote regions of Asia and Africa. Rajasthan, with a total area of 340,000 square kilometers and a population that exceeds all of France or Spain, would need at least 250 hospitals equipped for emergency obstetric and newborn care services for every mother and newborn to get proper health care. Udaipur district alone would need at least 11 such hospitals staffed by skilled doctors and support personnel to service its population. But the district, at present, has only 3. This glaring disparity, fueled by the difficulty of finding skilled doctors willing to work in these rural areas, has dragged down key health indicators in the state. Action, Research and Training for Health, or ARTH, is a grounded public health organization working in such communities for over 2 decades. As the name suggests, the organization uses research and training to help communities gain access and control over their own health.
आपकी उम्र कितनी होगा?
अभी हम 2 लाख जनसंख्या में ग्रामीण आदिवासी क्षेत्र में एक सर्वे कर रहे हैं। इसमें प्रसव के समय नवजात शिशुओं में वजन कितना होता है, उनमें मृत्यु दर क्या है, मृत्यु होती है तो क्यों होती है, यह जानने का प्रयास करेंगे। साथ ही युवा दंपतियों में परिवार नियोजन के साधनों का प्रयोग अभी वर्तमान में कितना है, यह भी जानेंगे। इसमें इसने तो बोला यस, और आगे जो भी मेथड है वो एक तरह से ब्लैंक आ रहा है। फ़ोन करके उनको बता दीजिए गलती हुई है।
We carry out research in 2 ways. One is to understand the situation in the community. We also conduct trials to try out new ways to treat people. And these results we take to the government. We disseminate them, we publish them in peer-reviewed journals to see that we contribute to an improvement in healthcare throughout the country and in similar parts of the world.
ARTH's original locations for testing innovations were the blocks of Kumbalgarh, Gogunda and Badgaon in southern Rajasthan.
In order to improve the availability of healthcare in interior rural areas, we would have to go beyond doctors and specialists who are absent. We adopted an approach which we call demedicalization. Now, essentially, this means you take less qualified persons but who train them extremely well. So, we established health centers, staffed them with nurse midwives. We also added health workers, and we even worked with volunteers in villages to see that they could treat conditions in the early stages, provide quick treatment, and also make sure that people got better. And when they realized that the treatment is going beyond their level of care, help them to refer to a hospital and to make sure that there is continuous review and retraining.
मेरा नाम सुनीता जाट है और अर्थ में नर्स के पद पे काम करती हूँ। मैंने एएनएम की ट्रेनिंग की है और हम वहाँ हॉस्पिटल ड्यूटी चित्तौड़गढ़ डिस्ट्रिक्ट हॉस्पिटल है वहाँ करते थे।
थोड़ी देर आप बच्चे को माँ के ऊपर ही सुला दिया, फिर ऑक्सीटोसिन इंजेक्शन जो है 10 यूनिट आईएम लगाना।
Although Sunita is already a trained nurse midwife, ARTH requires its nurses to undergo an in-service training from time to time to refresh their skills.
इसमें अपन क्या करते हैं वो आपको मैं
While Sunita's earlier responsibilities ended largely at assisting doctors, here at ARTH, the practical training has given her a hands-on approach in treating patients.
इस हिसाब से बच्चे को पोजीशन अपन को पता पड़ेगा।
यहाँ मुझे अकेले को सीखने को मिल रहा है, मुझे कुछ नहीं आ रहा है तो मैं आराम से पूछ सकती हूँ, आराम से वापस वो बता भी देते हैं, तो वो समझ में भी आ जाता है जल्दी और एक कॉन्फिडेंस आता है कि हाँ मैं कर सकती हूँ।
लेने के बाद फिर उसको उसी टाइम ही इसमें गांव से लगभग लोग सब हमारे अस्पताल में आते हैं डिलीवरी करवाने के लिए। उनको पता है इधर अगर ज़रूरत है तो ही आगे भेजते हैं। इधर हम कोई कॉम्प्लिकेशन देखा है, मतलब इसको नॉर्मल डिलीवरी नहीं हो सकते, इसका बच्चा सिसेरियन से होगा, हमें डाउट है, तब जाके हम रेफर करते हैं। सब पेशेंट को हम नहीं भेजते। उससे अपन को क्या है, 2-3 चीज़ का पता लगाना है एक बार में। पहले तो कितना डायलिसिस।
In fact, current pattern of training doctors and paramedics is to overdo the testing, overdo the treatment. The doctors and nurses have had to unlearn and simplify their approach. They've had to make sure that treatment is short, it's specific, without being unscientific. It means fewer tests, it means shorter follow-up, it means more direct treatment.
और 1 मिनट में 40 बार की दर से हम इसको वेंटिलेट करते हैं।
ARTH has carried out similar training programs on demedicalization for close to 600 government nurse midwives as well, enabling them to conduct deliveries with attention to quality.
तो बेसलाइन स्टडी रिजल्ट्स देख के हम ऐसा करते हैं कि अभी बाइवेरिएट एनालिसिस तो हमने किया है।
The research team at ARTH, meanwhile, has come back with data collected over the past 4 months.
नई वॉलंटियर्स हैं, वो इस तरह से उसका रूरल एरिया में बहुत कम प्रभाव दिख रहा है।
Two unmistakable trends clearly emerge. That of a lack of adoption of family planning by young couples, despite their wanting to do something about it, and a large proportion of newborn deaths within the first week of birth.
जैसा हमने अपने बेसलाइन के आंकड़ों में देखा कि नवजात शिशु मृत्यु दर काफ़ी ज़्यादा देखने में मिली है, तो उसके लिए हमने एक कार्यक्रम चलाया और ये जो कार्यक्रम है ये राजस्थान के 2 जिलों में उदयपुर और राजसमंद में चलेगा। उसके लिए हमने कुछ ब्लॉक छाटे हैं।
A new initiative called the Uday program is conceptualized to deal with the newborn deaths. It involves rigorous monitoring of a newborn at the facility level and continued care at the home. After substantial deliberation, the ARTH staff decide to pilot the Uday program in collaboration with government hospitals.
1 किलो 900 ग्राम ही से वजन, ठीक है, कम है वजन, तो ध्यान रखने की ज़्यादा ज़रूरत है।
Savitri has been at the hospital for the last 4 days after welcoming into her world a baby girl. Now under the Uday program, the Uday Mitra is keeping a close watch on the baby, checking on her vital parameters and offering all the support the young parents would need.
वो हमको समझा के गए कि बच्चा 1 किलो 900 ग्राम का है, बच्चे को ध्यान रखो, बच्चे को ओढ़ा फेरा के रखो, दूध पिलाओ दिन में 2-3 बार, बच्चा इधर बांधोगी तो वजन बढ़ेगा, वो ऐसा हमको समझा के गए।
हेलो, हाँ, आज
The Uday Mitra passes information about the newborn child to the ARTH call center, who in turn informs the community Asha worker, asking her to check on the child. In Padrada village, 15 kilometers away, a second initiative is underway. This one to address the need for family planning among young couples.
आज आपने सबने पता है कि एक खट्टा कीदा है, एक कन्या हारू कीदा है।
Nina has been appointed as a community mobilizer for this area. Her job? to create awareness about possible family planning options.
पर्दा वाली कोई भी तकलीफ है, लाल कपड़ा है, धोला कपड़ा है या और भी कई तकलीफ है, मैं हर गांव में जाती हूँ, महिलाओं के बीच मीटिंग करती हूँ और प्रजनन स्वास्थ्य पर महिला को बताती हूँ कि खुद का सुरक्षा कैसे रख सके या अपना खुद का फैसला वो कैसे महिला किस प्रकार कर पाए. આપણો શરીર આપણો ફેસલો તરુણી સકીરો કેણો હે આપણા શરીરનો ધ્યાન આપને રાખ.
Apart from building awareness and meeting the demand for contraceptives, community mobilizers like Meena have another important role to play to identify and train potential Taruni Sakhis who will be neighborhood friends, who can educate women about family planning methods and become themselves local providers for these products.
मैं एक ऐसी महिला को ढूंढ रही हूँ जो मतलब होशियार हो और दूसरी महिलाओं से घुल मिल सके और खुले विचार वाली हो.
Meena chooses Sita as the Taruni Sakhi for the village. She trains her and provides her with the tools and supplies required for the job.
जैसे यहाँ पे 30 रुपये में दो या गोली.
मैं तरुण सखी इसलिए बनी कि थोड़ा बहुत पैसे मेरे को भी मिल जाते हैं, घर का खर्चा भी निकल जाता है. जो सामान वहाँ से मिला है मेरे को वो सामान मैंने भी उपयोग किया है. तो महिलाओं को समझाती हो, गैप रखना हो तो मालाडी यूज कर सकते हो, कॉन्डम भी यूज कर सकते हो, तो इमरजेंसी गोली है.
ओ भाभी, आज बकरियां चरावा नहीं गया? नहीं गया. कई दवाई यूज करो कि नहीं करो? नहीं करो.
The survey revealed that there was very great demand among young men and women for means to control their own fertility. We therefore decided to launch a model based on village entrepreneurs who would educate women and provide them with simple commodities, for example, to test pregnancy and to prevent pregnancy, and to give it out at nominal cost and thereby earn a small amount and gain in social stature. At the same time, they were helping young people to control their own fertility.
It's been 42 days since Savitri and her underweight newborn went back home to the village. As part of the Uday program, a community worker called the Uday Prerak comes home to check on the infant.
नानियों का नाम क्या रखे हो? कहीं रखे हो?
हाँ रखे.
The baby weighs a healthy 2.7 kilograms. And there are smiles all around the household. About a month after Sunita started her training in evidence-based delivery care at ARTH, today she is preparing to conduct her first delivery at the center.
यहाँ पे यह सुविधा है कि पहले लोगों का डिलीवरी फाइनल करवा के आया हमारे वहाँ गोविंद तो वे ऐसे बोला कि वहाँ पे सही है तो आप भी वहाँ पे जाओ.
Sunita seems to have passed with flying colors. And the family is thrilled to welcome into their world a baby girl. Meanwhile, Meena and other community mobilizers like her are now on their way to other villages across the district to narrow down on more Sakhis in more villages. But data from the first village shows encouraging results. A significant number of women have adopted contraceptives from the village volunteer.
जो टेम्पररी अस्थायी तरीके जिन्होंने अपनाया वो 14% से 24% बढ़ गए.
For more than 2 decades, ARTH has disseminated the results of its many innovations and research studies through peer-reviewed publications in several recognized medical journals. It has almost rid its field area of maternal deaths and significantly reduced the perinatal and neonatal mortality rates. Despite these remarkable successes, ARTH continues on its patient journey of finding ways to make healthcare more accessible, of finding a way from hopelessness to hope.